You've had your surgery. First 48 hours have elapsed, and that really is the worst period in terms of discomfort, but also the highest risk point as far as complications like bleeding or tissue necrosis. So the first thing that I'm doing on this visit is making sure that there's no hematoma, which is bleeding internally, infection, or any kind of tissue necrosis, meaning there was lack of circulation and causing the tissue to not survive. Again, we fully expect things to be not normal. You're going to feel all kinds of unusual sensations, strange feelings, and those are not significant issues in the long run. Hopefully, you have not had any nausea. So after this visit, if you're continuing to do well, you can remove the patch if you put that on, and you can now get out of that initial bland, simple, boring, sick people food diet that I put you on. But again, you got to go nice and slow. And even with that, occasionally I get people, as they advance their diet, do get into trouble. They start to experience nausea. And if that were to happen, you just simply have to go back to the initial post-operative diet. Once again, back to the real bland, simple food. Be very careful as far as a lot of movements are concerned. Be very careful as to not take any medications on an empty stomach and just have to ride it out again. I will also be checking drain output on this visit. And usually about 1 out of 3 patients, the drain output is low enough where both drains can be removed. Otherwise, we'll continue with the drain care, and we'll have you come back on the second visit when the drain output is low enough for the drain removal. If the drain does come out on this visit, I will be seeing you again in about a week. If the drains come out, I usually have you wait 24 hours before showering. If the drains are still in place, I'm going to have you shower after this visit. You're going to shower, obviously, after taking off all your gauzes and tapes. In the shower, I do want you to wash the incisions and nipples everywhere with soap and water. I don't want you protecting it somehow by keeping it dry or just barely letting the water touch it. We want to keep that skin clean. Clean skin has fewer germs and it's less likely to get infected, especially early on when the skin incisions have not yet fully sealed. I also let patients shampoo their hair as well, which means you are bringing your arm up above your head, but the main thing I want you to do is go nice and slow. That way, as soon as you feel something, you're going to stop right away and you will avoid any kind of damage. Whereas if you're flying around with your arms, by the time you say ouch and stop, you probably have ripped something inside, and that's what we're trying to avoid. When you get out of the shower, I want you to apply simple antibody ointment, usually Neosporin, Polysporin, Bacitracin. Stay away from ointments that contain pain cream or some kind of scar cream at this point. And then you're going to be putting on simple bras. I had you wrapped up until this point, and I probably will wrap you again after this visit, but after you shower, no more wrap. I find that using wraps has not been helpful in my practice because the wraps are no longer taped in place. They tend to move around and put pressure in places where I don't want them. So I've just had better luck without the wraps. So the next time I'll see you, as I said earlier, will be 1 week if the drains get removed on this visit. If they're still in place, we'll try to combine your second visit with the drain removal, so you'll be calling my office with the daily drainage output. But I'm basically looking for less than 30 cc's of output per side, so they both have to be less than 30 cc's for 24 hours before they're ready to come out. So again, congratulations, you've had the surgery, the worst is over. You've now gone past the most difficult part of the recovery, the first 48 hours. You've gone past the most painful part of the recovery, the first 48 hours. And you've also gone past the most dangerous period, first 48 hours in terms of complications.